And what you will learn in this case is that Ron's life was taken from him unnecessarily, needlessly, because the doctors violated the trust that Ron had placed in them to take care of him. And as a result, Glenda's husband lost his life, needlessly but painfully, because Dr. Friedland did not tell Ron the truth about his test results. And Dr. Venkatesh took Ron back into surgery without getting cardiac clearance. They take a picture of his heart. A few days later, the results come back. These are the results for Ron. It comes back and it says that he has a 469 score in his LAD. The LAD is the left anterior descending, the widowmaker artery. He's got plaque in other parts of his arteries as well in his heart. So he's got a total calcium score of 672. The radiologist who interprets this report explains what that means. And he says a calcium score greater than 401 corresponds with extensive atherosclerotic plaque. That's just a big medical word for the gunk inside the artery. Extensive atherosclerotic plaque. He goes on to say, there is a high likelihood of at least one significant coronary narrowing. A high likelihood. Although Dr. Friedland had told Nurse Clark to call the patient with the results, no one from cardiovascular group ever called Ron to tell him about these results. Instead, Nurse Clark sends a letter. This is the letter she sends on October 30th. It starts off, Dear Ronald Yarborough, your recent coronary or your calcium score was reviewed by Dr. Friedland. It showed no significant calcification in the arteries leading to the heart. It showed no significant calcification in the arteries leading to the heart. Everybody on the defense side, Dr. Friedland, Nurse Clark, will testify that this was a typo, that this was a mistake. In fact, in Dr. Friedland's testimony in his deposition, he said, well, aside from the word no, the letter's accurate. But this is a letter that Ron got. 2 weeks later, Glenda, so 2 weeks after getting the 672 score, Glenda calls back to the group, calls back to cardiovascular group. It's a typo. It says patient's sister called. You'll hear the testimony. It was actually Glenda who called. And she said, the patient's sister called and stated her brother, Ron, is having shortness of breath and diarrhea from the new medication. Dr. Friedland had changed his cholesterol medication, and this is what she thought was going on. She goes on to say, the patient says since starting the rosuvastatin, that's one of the cholesterol medications, he's had tightness in his chest, shortness of breath, walking to the mailbox. So a patient who's just had a 672 score, 469 concentrated in his widowmaker artery, 2 weeks later, he gets a letter that's inaccurate, and then 2 weeks later they're calling back reporting symptoms of chest tightness and shortness of breath. There's the only response, and then they ask to call him. They say, please call Ron. This is Ron's cell phone number. And they ask the doctor to call. No phone call, no contact. The only thing Dr. Friedland does is, a few hours later, Dr. Friedland says, stop your new medication and go back to your old cholesterol medication. Stop and go back to simvastatin. Well, statins do not cause cardiac symptoms like shortness of breath and chest pain. So in response to this call from Glenda, reporting these new symptoms, asking them to call Ron, Dr. Friedland does nothing except adjust the medications. There's no discussion with Ron about the significance of chest pain and shortness of breath in the setting of a high calcium score. There's no instruction to come to the office or maybe even go to the ER. You may be having a heart attack. No instruction at all. There's no stress test, and there's no discussion about a CT calcium score. Just adjust his medications, and Ron goes on.